everyone, and welcome back to your favorite medical-based podcast, Med Scholars. Today's episode is all about Gen Z in the world of neurosurgery, how we see the field, how it's changing, and whether Gen Z has what it takes to carry the scalpel forward and become the next great generation of neurosurgeons. Joining me today are not only one, but two very special guests with a strong connection to the field. From the YSSA Zürich, representing Gen Z alongside me, is aspiring neurosurgeon Faizan. And straight from the operating room is co-founder, co-host, and neurosurgeon Dr. Stefan Motov. We're thrilled to have them both here with us. And stay tuned, because this is going to be an episode you won't want to miss. Getting straight into the topic, neurosurgery. Such a vast field, a difficult field. When you hear the word neurosurgery, what is the first thing that comes to your mind? Why is this a field that interests you so much?
Faizan?
So for me, as I said, I'm a medical student. I have interest in neurosurgery, overall actually in surgery. And when I hear the word neurosurgery, the first I have in mind is the first operation that I saw, the spine operation that I saw, and I was fascinated by that. And also the craniotomies that I saw, and that was the first time when I told myself, okay, this is what I want to do. Okay. So that's the first thing I hear. When I hear neurosurgery, that's the first thing in my mind.
And for you, after so much experience in the operating room, what is the first word? Or what is neurosurgery for you now?
It's not so much, but because I'm also young.
Yeah, sorry. Of course, yeah.
Well, for me, it's a very vast and very interactive field in medicine, and it's also combined with technological progress, because we use a lot of technology nowadays and try to develop it and improve it in the operating theater. So for me, it's a very interesting topic, and of course it's part of my career, so something that I see every day, and still also fascinates me.
Of course. You mentioned the technological advancements. What kind of technological advancements are there in neurosurgery? It is a young field, right? So they must be coming really fast? Or how is this in comparison to other areas in medicine?
It's not only the surgical tools that we use, but also the media that we are provided with from the industry. So, for example, like augmented reality or navigation, robotics, endoscopy, these are all technologies that are right now in the development, and we try to implement them and we try to improve them in order to provide our patients with the best medical care.
And for the audience, Faizan and YSSA, they have a student society of neurosurgery. And I want to ask a question regarding this. These advancements, are they implemented into your student society, or how do you deal with this, like this change that is happening so constantly?
Yes, so first of all, about our association, we're a platform for surgery for medical students by medical students. So we basically teach medical students the basic OR skills, suturing and also surgical education, where we have different societies. And one of them is the Neurosurgical Student Society, where we have around 15 very highly motivated people. And so our main goal is that they are ready for the residency. And we are aware of this technology advancement, because in the past 5-10 years it's been crazy. And one of our main goals is to keep up to date with the latest technology. So that's why we are planning to do and collaborate with different medtech companies on minimal invasive spine trainings, and also the robotic surgery. So we'll be doing that soon, next semester.
Oh, very nice. You mentioned highly motivated students.
Yes.
And because this topic is about Gen Z, would you say that Gen Z is a very highly motivated generation in comparison to, let's say, your generation? What is your view on Gen Z in general?
I think that the motivation is not a problem for Gen Z. It's part of the species, because you have to deal with all the things like internet, social media, etc., that has been implemented over the last 15 years. So you're kind of very interactive. You can provide information much quicker than our generation or the generation before. I think a major issue or a major problem is, of course, that the curriculum has to develop according to these technological advancements, and this hasn't been present in the last few years. So I think this is probably what we have to address in the next few years. We have to adapt to this certain atmosphere and to kind of connect and kind of bond with your generation in order to get you to our specialties, because our specialties are like really demanding a lot of commitment. You have to be able to be perseverant, to have perseverance, to be on the edge and to learn a lot of information and to also assess it quickly. But of course, you have to do it by heart and do it with a lot of fascination, just like him. So I think this is something that we have to work on, and that Gen Z is right now missing, the work-life balance on the one side, but also the mentorship, the teaching, and the structured, infrastructured education.
Do you agree in your student society based on this?
Yes, I actually completely agree with what Stefan just said. And regarding the curriculum, I'm from the University of Zurich, and I think it's an amazing curriculum because we have the theories, which are amazing, and we also, the curriculum is patient-based, problem-solving, focused, clinical reasoning-based curriculum, which is amazing, and I feel every doctor, every physician should know that after the medical studies. But what is kind of missing is the technology advancement, as you said, right, or the practical skills, which needs to be implemented. And that is what is missing, and that's where we came in and we said, hey, okay, let's bridge that gap. And so that was the missing thing. And I also agree, motivation is here, but I guess motivation, it comes and goes, but what really is important is ambition, right? Because ambition is the inner drive to succeed or to contribute to the society, because at the end, we all have one goal, and that's to have a smile on the patient's face when the patient goes out, right? That the patient is satisfied. So in order to achieve that, we need to work all together and then have this ambition towards our one.
So the technological advancements are the sole reason? But you mentioned mentorship. Is that something that is actively being corrected, basically? Like, are mentorship programs available for people who want to pursue a career in neurosurgery? How is it like that right now?
Well, at least in our hospital it's provided, but it's not in every institution probably present. And I think the problem for most students who want to start with some kind of surgical specialty is to find a mentor at the very first place. So as soon as you start your residency, it's sometimes too late. Maybe you get somebody who is attached to you, but maybe you don't get to know anybody. And not in every clinic you have a provided, mentor to whom you can speak and you can discuss problems, or you can discuss any kind of difficulties throughout your career. And this is something which is very important, because a career trip is like a marathon. You're not going to get to the end if you don't have enough help, enough aid to get through the difficulties and to develop this kind of perseverance. So I think this is a major issue. And of course, the second problem is you need to adapt to the modern technologies and to use them. Otherwise, people are not going to stick with you, because everybody wants to be updated and to do what is really the future, not what is the past. So you have to, of course, learn all the basics, but you have to also adapt to the modern technologies and to use them in order to get better and to improve your efficiency also.
And mentorship, is this a topic that is discussed in the student society? Like, do the students there have mentors actively right now, or?
Yes, so a lot of people do have mentors, and I believe mentorship should happen naturally, right? There are mentorships program at our university, but it has to be natural. You cannot force a surgeon and a student to go, hey, get along and work together. You cannot do that. It has to be natural. And I think, as Stefan said, it's very important to have a mentor, because you as a student, you don't there's a curtain in front of you. You don't see the reality, right? Because you're in the studies, you're in the lecture hall, and you don't see the reality. And if there is someone for you, a mentor, he can guide you to the route, right? And also through the ups and downs, he can help you through it. So I think it's very essential to have a mentor, but it should happen naturally.
Yeah, it should happen naturally.
It's a very good thing that you say it, and I think it's also putting something into perspective, because you develop throughout your residency, and later on also when you're attending, you still develop the first years. So you need also somebody who can guide you through your life, not only through your career. So on the one side you have the career goals. You want to become attending, first of all, residents, than attending, and then maybe you want to have any kind of boss or chief profession, but it's developing over time, and you need certain skills, and you develop certain skills throughout mentorship and not only throughout experience or throughout any kind of procedures you're gonna do.
And you know, it's interesting that you say skills. What skills does a neurosurgeon need specifically? What does a neurosurgeon have to train to become a neurosurgeon?
Well, you need basically a very good knowledge of anatomy, and also you need some very good haptics to perform different procedures, and this is something you can develop, of course, with a lot of hours of exercise. But I think the most important skill that you have to possess is to be able to diagnose patients correctly, because procedures are something that you can learn. Of course, some people are more talented than others, and those who have less talent have to exercise more, but at some point you can beat the talent with enough exercise, just like in sports.
Of course.
Yeah.
But at the end of the day, you need really strong knowledge, some social skills. You have to be able to communicate diagnosis with patients. You have to be able to understand what is going on with them. And of course, you have to be a really good clinician. You have to have really good sense for diagnosing and for establishing treatments.
And in your opinion, like, we are representing Gen Z, do you think that our generation can possess these skills? Like his generation, if I can address them as so.
Thank you.
They, in my opinion, in my view as a Gen Zer, guys are very hardworking. You weren't as much as concerned with the work-life balance as we are now. We're very vocal about it with social media and whatnot.
Which is good.
Which is good.
We have to talk about it.
But is this mindset okay for like neurosurgery? It is a very hard field, if I may say so, without any experience. It is a very hard field. A lot of years for residency. You could see maybe why some Gen Zers are trying to get off that track.
I don't believe you have to be Navy SEAL to become a neurosurgeon.
But that is the image.
It's a completely wrong perspective, I think. You have to have perseverance. You have to be able to concentrate, to focus on a problem and to solve it and to stay with it till the bitter end sometimes. But at the end, it's not about becoming the strongest or the hardest at work. It's about a work that you like, that you love, and that you care about. And you have to care for your patients. This is what makes a good surgeon and a good physician. And I don't think you have to be the superstar of your team. You have to be able to work in a team and to make your team better. And in a team, there are different roles. So you have to be able to understand your role, to perform your surgeries, to learn your surgeries, and to give your best. But you don't have to be always the ego shooter, you know?
That's true. Can we do that? What do you think?
I think, yeah. I mean, neurosurgery has been there since many years, and I'm sure that we can also do it. And one of the biggest advantage that Gen Z is carrying is this is adaptability, right? We can quickly adapt to new technologies because, I mean, the change from papers to iPads, we went through that. You know, at schools we used to write in papers, and then suddenly after Corona we had to give assignments through Teams, and everything was digital, and we had to grow through that. You know, we grew through the hurdles, so we can adapt very quickly, and as we spoke at the beginning, technology is advancing, and I think one of the most important skill is to adapt quickly and to be ready to try out new stuff. I think that's very important.
But we live in an age of social media where content initially was 60 minutes. We're making a podcast that is around 30 minutes. Soon, like, the content is getting shorter and shorter, and our attention span is getting even shorter. I think this may be a problem with Gen Z, because I don't think we have what it takes to do things long term. Or what is your opinion? Like, to start something and do it for many years, I think that is, in my opinion, a hurdle for neurosurgery.
I think it's less the time span that you can focus on. I think it's more the problem that you don't want to commit to something. And sometimes in life you have to make your decision and to commit to something in order to proceed. Otherwise you're gonna get stuck in a vicious circle. And I think this is probably the main problem. You guys have to be more decisive. And in order to get more decisive, you have to commit to some things and to try it out in order to understand if it's the suitable thing for you or not. And if it's not, it's trial and error. Then you proceed with the next thing. Sometimes it doesn't work out as you have imagined. And the same thing is also in every specialty. We do what we think is the best for the patient, but it's not always the best for them. And sometimes you have complications, you have some kind of problems, and you have to deal with them. And this is something which you said is probably your advantage. You can come up with solutions much more quickly because you can process information quicker than us.
Yes, I actually completely agree with what Stefan said. The Gen Z has this career fluidity mindset. I mean, I don't say that's a bad thing. The thing is that Gen Z, they are more open to switch careers very quickly, because through social media they see all the possibilities that they can do, right? And it's very easy to choose multiple paths and to do things at multiple things at the same time. And of course, after the medical studies, they confront with this hierarchy that is there in the surgical training. I'm not saying everywhere, but there is this hierarchy, and they don't like it. Most of even my colleagues that I know that started residency, they don't really like that hierarchy. You know, they want freedom, they want more freedom, and they need trust, and they need a good team. Because if you have all those stuff, then you will be willing to work more. You know, if you have a good team, a good environment, and a good teaching, of course, then you would work more because you like it. You know, and that's how it should be. You need to like something, you need to love something. When you wake up at 6 o'clock in the morning, you need to know, okay, I love what I do, that's why I'm going there. You know, so you need to love the job, basically. Yeah, and there is
absolutely. You have to relate with what you're doing. Otherwise, if you don't have a personal relationship with your profession, you're not gonna love it. You're not gonna be able to be more productive.
Yeah.
And efficiency comes with exactly this moment of joy, doing something.
Okay. And compared to other surgical specialties, neurosurgery can, like these attributes that you just said, a passion for something, this can be applied to basically all surgical specialties. So do you guys know the trend, how it's going? Like, are Gen Z deviating from neurosurgery? Are they going more towards neurosurgery? What is your gut feeling? Or do you know anything about this? Or how does it look like in the student association?
It's a good question. A lot of people, it's actually very diverse. You know, some people are very interested in surgery overall, and some people more into internal medicine. I think both subjects are beautiful on their own, and I don't see any trend right now. I don't even see people not wanting to go to neurosurgery. But what Gen Z values is the work-life balance, right? It doesn't mean that we want to work less. It means that we want to work smarter. You know, we don't want to be behind the laptop, behind the computer all day, but we want to be close to the patient, and because we want to treat the patient, and that's why we started studying medicine at the beginning, right?
True.
And people often tend to forget that, why they started studying medicine. And you need to know that, okay, I'm there to help my patient, and I need to learn how to treat and how to diagnose my patient, and real growth happens with the patient, right? And there was a study, it was conducted in 2023 by the Swiss Medical Students Association, and if I may quote, during medical studies, 34% of the students think about not starting to work as a doctor because of the expected working condition during their residency. 34% think not becoming a doctor at all. That's a bit concerning, right? So we need we need to change something in the system, right? And one of the main reasons was the reason I said, being in front of the computer all day.
Do you agree?
Well, we have actually performed a survey in Germany and in Switzerland last month, and we haven't published the results yet, so I'm not gonna quote any kind of numbers, but
Okay, yeah,
I
sure.
can tell you that students have a diminishing interest in neurosurgery,
Mhm.
Okay.
less interest in residents, obviously,
Mhm.
but still they have a high interest, and the problem is for most of them why they don't want to do a neurosurgical
Mhm.
residency, the absence of good mentorship and teaching.
Mhm. Mhm.
As you said, the work-life balance, which
Mhm.
is not optimal, of course, and also a problem with the hierarchies. So we
Mhm.
have very strong hierarchies in neurosurgery, and this is because it's still a young discipline, but with a very old military-like structure. And this is something that we have to change in the next few years, because more and more students are going to be female, and more the parenting
Mhm.
problem is going to be obvious, and a topic that we have to
Mhm.
discuss, and we need some kind of solution for this.
Mhm.
Therefore, I think it's very relevant to talk about it, and to change stuff right now.
Mhm.
Yeah, absolutely.
And if we're always talking about work-life balance, maybe you could just tell us about your work-life balance. How is it you are a neurosurgeon, so you could maybe tell us a bit, how does a typical day look like?
Well, I haven't picked up neurosurgery because of work-life balance. It's
Sure.
obvious that this is a specialty where you have to maybe do an extra mile than
Of course.
general practitioner.
Mhm.
But still, it's a very exciting field, and we have balanced work hours, as we have some kind of not only holidays, but also some kind of we have some compensation days where we can reduce our working hours. So
Okay.
on these days I can see my kids, I can see my family, I can do something for me,
Mhm.
but still I do, for example, research in my free time. This is something that is not during my working hours. This is the extra mile that you have to put into something if you're interested in it.
Mhm.
You don't have to do research, it's not mandatory, but if you don't do research, if you don't go to conferences, if you don't do some scientific exchange with your peers, you're not going to be up to date. And if you're not up to date, you're not going to provide your patients with the best possible care. So in my eyes, if you want to be relevant, if you want to not only do procedures, but really develop something or improve something, then you have to do also research. And it's part of your business. You have to do it in your free time. And it is in every hospital. So this is something you have to keep in mind when you get into any kind of specialty. It's not going to be only neurosurgery like this. And free time is something which is very nice, but I think if you decide to go to medicine, it's because you want to help people. So you're always going to be on the wrong side. You're always going to be on the side that you have to sacrifice some time for other people, and not on the side where you have to demand your time.
True. Yeah.
So you have to be able to distinguish this and to understand this. Otherwise, you're probably in the wrong profession.
So one quick question. We are all on the same page that something has to change so that Gen Z and neurosurgery are a better match.
Absolutely.
Where do you think the change should come from? Where is the place that the change can be sparked? Any idea?
I think we have to reduce administration in hospitals, which is a big problem. And we have a lot of administration, not only in Switzerland, but also in other European countries. And this is something where, for example, artificial intelligence can help us with. Because, for example, writing surgical letter or a letter of discharge, this is something that artificial intelligence can provide you nowadays, really very accurate way, and you have to just correct it in a few minutes. This is something that saves you time which you can need for your patients, time which you can take as a free time, maybe, time which you can invest in other procedures or even in education. And this is something that we have to utilize more. Artificial intelligence, machine learning, this is something that is probably part of the future, not in every hospital. So this is one of the points, and this second point that I think that we have to really think about or really restructure is also 24-hour shifts and the shifts during the week. So people have to be able also to get 80% or 60% working possibilities in order to do their parenting or to do research or whatever. So this is something that we have to also provide in neurosurgery.
And from the YSSA's perspective, you have many other societies as well apart from neurosurgery. And I'm just mentioning this because do you see, like, what other specialties do you have?
So we have now currently 5. We have Neurosurgery Society, visceral, heart surgery, plastic, and orthopedics.
Okay. And taking these 5 specialties, just based on, you definitely have to like register there to be a part of the society.
Yeah.
Is there a difference in like how many people want to register? Can you already sense in which direction Gen Z is heading? Like, do you sense a preference in what specialties Gen Z want to do in the future? Or is neurosurgery the most popular?
So currently, all societies are more or less the same. We have the same number of people and everyone can join. So it's actually open to anyone. And we don't see, as I said, we don't see a trend right now to any specific specialties.
Okay. It's a fantastic idea that you do this kind of extra work for your peers, because the initiative shows that the interest is there, and also is when you start with something like this in the very beginning of your student's career and develop it further into residency, you're going to be able to do much more stuff when you become a resident yourself, because you already have some certain skills. You have developed this through simulator training, through augmented reality, and then you can also build up on this. And this is something that makes you also attractive for neurosurgical or other departments, you know.
Yeah, so the growth of YSSA is all the teamwork. So, you know, that is what I really want to say, is that surgery really needs a teamwork, because it's not only about personal growth, you know. You need to support your peers, you need to support people who are close to you, and you all need to grow together, because as a team you can do much more, you know, and that's what you need. And in YSSA, we had a great team at the beginning, and at the YSSA it's at this stage because of this wonderful team, you know. So I think teamwork is the best thing. Yeah.
True. So we're coming slowly to an end, but before we end the podcast, you two are advocates, obviously, for neurosurgery. Maybe you could give our audience one last message, our Gen Z audience, as to why they should consider neurosurgery.
See, I think it's important to mention that we are privileged. You know, we study here in Switzerland, and we have a top education, top researchers. I mean, where can you find a place where we have ETH, the USED, UZH, everything together within 100 meters? There are top people, top researchers there, and we get a wonderful education, right? And I think that people need to know that and need to use that. You know, you need this inner drive to learn more, to study more, to do research. I think that's what is missing, at least in my peers and in my class. You need to recognize, hey, I'm really privileged. Let's use it.
True.
You know, and let's work together and grow together. I think that is very important. If you want to do neurosurgery, you need to work together and grow together.
I'm going to base my answer on the results from our survey. So the most fascinating thing for most residents and students in neurosurgery are the procedures that we do.
Yeah, of course.
So the surgical procedures, they're really unique. They're very, very different, and you have a vast amount of different stuff that you can do. And it requires also a lot of skills, haptic skills, visual skills, auditory skills, and a lot of knowledge. Therefore, this profession is not going to be probably released by robotics in the next 10 to 20 years. So if you want to become a part of this future and maybe develop even further technologies, I would advocate to get into neurosurgery and to get involved in there. And also we need some young people that can relate to the specialty, but also can change the infrastructure and the perspectives. Yeah.
Thank you guys for being here on the podcast. This is
thank you
kind
for
of like
the
the
kind
end.
invitation.
Yeah, thank you for having us. Yes.
It was a very interesting discussion, and hopefully we can give you guys even more further such discussions in the future. Yeah, and with that I would like to tell you guys, stay in touch, follow us on social media, on YouTube. Obviously Spine Docs is also a podcast, go check it out. YSSA in Zurich, if you're in Zurich, go check out their events, and there might be a collaboration coming up soon between Med Scholars and YSSA, so stay tuned in for that. Thank you, and see you next time.
Thank you.
Thank you.